Celiac disease is a systemic autoimmune disorder, meaning it affects several parts of the body and results from a dysfunction of the immune system. It is triggered by the ingestion of gluten, a protein found in certain grains, mainly wheat, rye, and barley. Epidemiologically, the true frequency of celiac disease is largely underestimated. In fact, what is observed in clinical practice, the diagnosed cases, often represents only the tip of the iceberg. Populations like the Chinese and Japanese are much less affected as they very rarely carry the DQ2 gene. However, in the rare cases where an individual from these populations carries the DQ8 gene, they may still develop the disease. Celiac disease can occur at any age, in infants, children, adults, or even the elderly. There is therefore no specific age period at higher risk. Once the diagnosis is established, treatment relies entirely on a strict gluten-free diet. In general, eliminating gluten leads to a progressive improvement of symptoms and regeneration of the intestinal mucosa. Celiac disease results from a complex interaction between genetic, environmental, and immunological factors. The main predisposing factor is genetic. In fact, the majority of patients carry specific HLA system genes, particularly HLA-DQ2 and HLA-DQ8. However, carrying these genes does not automatically mean that a person will develop the disease. Other factors also play a role. There are environmental factors that seem to influence the risk of developing the disease. Breastfeeding may have a protective role, although studies remain inconclusive on this point. The timing of gluten introduction into the infant's diet also plays a role. Finally, certain viral infections, especially at a young age, may disrupt the intestinal barrier or stimulate the immune system, thus facilitating the onset of the disease. A key player in the inflammatory process is a molecule called interleukin-15. This substance, produced by intestinal cells, contributes to damaging intestinal cells and maintaining chronic inflammation. It plays an important role in the persistence of intestinal lesions even after the initial exposure to gluten. So in genetically predisposed individuals, the consumption of gluten triggers an abnormal immune reaction. This reaction occurs in the mucosa of the small intestine, where the immune system overreacts to protein fragments called prolamins, especially gliadin, a component of gluten. This reaction leads to atrophy of the intestinal villi, along with an increase in lymphocytes within the intestinal epithelium. These changes disrupt nutrient absorption, which can cause a malabsorption syndrome. So, celiac disease is the result of an imbalance between genetic susceptibility, environmental triggers, and an inappropriate immune response leading to chronic inflammation and damage to the small intestine. When celiac disease is not diagnosed or the gluten-free diet is not properly followed, certain complications can occur, sometimes severe. These complications are more frequent in refractory forms where symptoms persist despite complete gluten exclusion. First, ulcers. These are ulcerative lesions that appear in the upper part of the small intestine, particularly in the duodenum and jejunum. They are generally observed in severe and refractory cases and can cause pain, bleeding, or malabsorption issues. Secondly, in rare cases, collagenous infiltration of the intestinal wall, called collagenous sprue, which is an abnormal thickening of the intestinal wall that occurs due to collagen accumulation. It can lead to more pronounced nutrient absorption, impairment. 3. Hyposplenism. This refers to reduced function of the spleen, which is the organ involved in the immune defense. It is often identified by a decrease in circulating lymphocytes or white blood cells. This immune deficiency can expose patients to an increased risk of infections. Fourthly, mesenteric cavitation, a rare complication characterized by the formation of cavities containing enlarged lymph nodes. It is often associated with chronic inflammation of the mesentery. In prolonged or poorly controlled disease, the risk of developing certain types of cancers increases, including small intestine T-cell lymphoma, which is the most frequent and feared malignant complication in this context, non-Hodgkin lymphoma, another form of lymphatic cancer affecting the intestine, epithelial carcinomas that originate from the lining cells of the intestine, and finally, adenocarcinomas, which may affect not only the small intestine but also other organs such as the breast. These complications highlight the importance of strict adherence to a gluten-free diet, not only to relieve symptoms but also to prevent progression to severe forms of the disease.